So the second picture on the right side is her pictures after the recovery time. She still looks exactly the same, except she looks younger. The lines are not as obvious. The marionette line around the chin disappeared. The nasolabial line is still there and hasn't changed its direction. Lower lid bags are gone, and the upper lid excess skin is gone, but she doesn't look like the proverbial deer in the headlight or hollow-looking eyes. We have a second set of pictures. Same patient on the side view, and you can see on the left side how those lines that I was describing before, and the sagging cheek and jaw lines, and on the picture on the right side, they have either disappeared or they're much less visible. At the same time, I want you to look at the picture on the right side. On the ear area, you do not see any incision line. That's how it healed, and there's no way to guess that that patient had surgery. Second patient here shows on the left side, before the surgery, she had this sagging of the face, as I described before, with multiple folds on the face. And again, the nasolabial fold, which is pretty pronounced, and the marionette lines around the chin. She also had sagging of the skin of the upper lid. And during the surgery, all that has been addressed with the mini facelift and upper lid blepharoplasty. And on the right side, you can see the same patient 3 months later, completely looking natural. She's extremely pleased because she doesn't look like being pulled. She doesn't look artificial, but she has achieved what she wanted, a younger, fresher look without being artificial. Next set of pictures is the same patient from the side, and you can see how the lines again are much softer. The jowl line is gone. The skin is much smoother looking and younger looking. That's the difference between the older face and the younger face. The younger face has a nice, smooth, almost a little bit shiny look to it, as opposed to the older face, which is fine wrinkles and sagging, and that is gone. Third set of pictures are for another patient of mine. You can see from the side how the jowl was a big problem for her, and the nasolabial fold. You can see it from the side. And also she had upper lid sagging of the skin. This picture on the right side, it's after the surgery, much smoother, much tighter face, but again, she still looked the same. She doesn't look like she's being pulled. The jowls have disappeared, and she was extremely pleased as to the normal look she had without having that face in the wind effect. Again, no scar line visible. That's the same patient from the front view. She was very sensitive to flashlight. It was tough to get one with the eyes open, but you can see the face, the difference before and after surgery, how especially the cheek area and the nasolabial line and the marionette lines have disappeared and softened.
Some very impressive results, Dr. Hormozi, and what stands out, in addition to the ladies looking years younger, is the fact that they look very natural.
That's the goal. As I mentioned several times, that's the goal. And if they don't look natural, they will be always unhappy because their friends will make their comment, "Oh, you look pulled." And sometimes friends can be pretty rough.
That's right.
Because when they see something that you have your facelift, either they're jealous and they will make a comment on it,
Yes.
Or they have comparisons and they say, "Oh, yours is not as good as my friend," or this and that. So when they can't see the result, they cannot see the incisions, they cannot see that there is something major changed, they just have to accept you that you look younger, that's all.
Are there any follow-up visits that a patient would be looking at from the mini facelift, doctor?
Absolutely. They're sutures, which is basically, as I described before, placed at the level of the ear and goes behind the ear, although they're not much visible during the recovery time because women in general, they can put just the hair in front of it and go on with their life, but I do have to remove those, and usually removed about 9 to 10 days after the surgery. Very simple. They're running sutures, so it means there's one knot on the top, one knot at the bottom, and a third one behind the ear. I just cut the knot, pull the whole thing out, and it's finished. It takes a couple of minutes to remove that. The next follow-up for me is about 3 months later, just to see how everything is going. And obviously, I'm always available for my patients, but that's not required to do anything more than wait for the recovery, a complete recovery, and see how everything will.
That's it?
Yeah.
We're now going to meet one of Dr. Hormozi's patients. Welcome, Lynn.
Thank you.
Oh, it's our pleasure to have you. We always appreciate it when patients take some time to come down and share their experiences with us. And on that note, I'd like to begin by asking you if you can please tell us, what did you have done?
About a year and a half ago, I had a mini lift done.
Oh, a mini lift.
Yeah, mini lift's a little different from a full facelift. Mini lift is more to, lift the sagging skin in this area and on the chin area.
Doesn't entail as much as a traditional facelift, for instance.
No, it's not as intrusive, invasive. And it was virtually painless.
And why did you have it done?
Well, to be perfectly honest, when I was 40 years old, I said I would never do anything like this. When I was 50, I said I would never do it. And when I hit about 58 years old, I started noticing the skin hanging. And a lot of people were asking me a lot, or quite often, if I was tired, or if I felt okay. So I started having a very tired look. And when I get up in the morning, I feel like I'm 30, and the mirror says I'm not. So I wanted to refresh myself. And basically that's what it does. It gives you a nice, refreshed look, lifts the skin a bit, so you don't look quite as tired.
Well, you certainly look great.
Well, thank you.
Procedure, I take it, itself, as far as what it entails, like length of time in your case?
Took about an hour and 15 minutes.
That's it?
That's it.
My goodness. And how do you feel about the results?
I'm pleased, very pleased.
You do it again, I take it?
In a minute.
Wow, well, you look great, Lynn. You
Well,
really
thank you.
do. I mean, you're beaming. Look at you.
Oh, thank you.
Well, on that note, thank you, Lynn, for joining us and being a guest on A New Me.
I thank you.
It was our pleasure. We're now back with Dr. Hormozi. I must say, Lynn was beaming with happiness, and she certainly feels great.
Good. I'm glad that you enjoyed the way she looks, because she, like all my other patients, it's the natural look, and they're happy about it. I continue to emphasize that. The natural look. If a patient gets that natural look, a younger look, that's all they want.